For that. That was really wild. I'm just so grateful that wasn't my brain being scanned for functioning. It's always terrifying that they're going to ask me to be the subject on these things. So our next discussion will focus on continue really the conversation we had before Olivier's presentation on how these new revolutions, these multiple revolutions, are disrupting healthcare. And those are, of course, artificial intelligence, robotics, cognitive computing, and so much of what we talked about before. To share their insights, please welcome Frank Hester, OBE, Ray Yang, and Nini Wang. This is a cool discussion because, you know, you're all doing really, really cool things. I want to start with you, Frank, but I have to mention this OBE because you were awarded the Order of the British Empire, and I asked you last night if this meant that I had to call you Sir Frank, and you said, no, that's a different Order of the British Empire or something like that. So what exactly is the Order of the British Empire?
Well, what it mainly does is it gets me room upgrades, which is really in hotels. It's an award from the country. I've worked with the NHS for 20 years. That's our healthcare service. And it was mainly because we joined up doctors talking to doctors, right. And that hadn't been done before.
See, that's an amazing thing. Getting doctors to talk to doctors gets you a knighthood. That should tell you so much about the healthcare system and how dysfunctional it is. But, you know, Sir Frank, and that's the only time I'll call you that, but you began as a software architect in the financial sector, an industry that's actually been very consumer-directed. From mobile banking, everybody on their phone can go and check out their bank balance and do whatever they want now. When's that going to happen to healthcare?
I think we've all seen the revolution with the fintech and the travel agencies. Yeah. It hasn't quite happened yet with healthcare, although I think Nini will tell you different. Lots of good things are happening, but we haven't quite had the revolution. And I think that's because at the moment, you still need a doctor or a nurse. It's very labor intensive. But I think some things are coming along, a lot of the electronics. I know we're going to talk about AI in a while. That's a.
But you mentioned, but the mobility. I mean, the same smartphones that we have, that every one of us has, and we're doing 1,000 different applications a day on. I mean, we can start to use that as well, right? Yeah,
but at the moment, you've still got to connect with the one doctor.
Yeah.
So it's kind of good. You can do it from home. That's really, again, Nini knows more about this than me, but you're still, at the moment, talking to the one doctor. But I think the revolution will come when we can amplify the voices of the doctors and nurses.
So, Nini, I do want to come right to you now, and I want to talk a little bit about part of the challenges in this healthcare system. And one of them is represented here in China. The Chinese population over age 60 will be 324 million by 2027. That's just 7 years away. Essentially a doubling of this cohort of people over 60 in the next 7 years. And you've spent much of your professional life anticipating the challenges that this demographic shift brings to healthcare. What new tools will we have to deal with this, to figure out how to keep costs down in particular, but get better care to these seniors?
Sure. I think most people think about the huge number of people beyond a certain age and think that's the main cause of the challenge, and think diseases are our main enemies. I would add another dimension to health, as we all expect to live much longer in our next 50, 100 years, which is function. Our physical and mental function ability actually determines much more how well we live beyond a certain age. So in China, I think there are two unique challenges that can be turned into opportunities. One is how we could actually better predict and prevent care dependency. So instead of thinking, how are we going to care for these 300 million people, beyond a certain age, or hundreds of millions of people who are dependent and needing care. Why can't we think, how can we reduce people's period of care dependency or disability and enable more people to live a better, healthier, more active life until the very end of their lives? So predict and prevent, that's something we all know technology could enable.
Right.
And the second thing is to actually have the capacity to deliver care services for those who are then in need of care. And we are talking about shortage of nurses, shortage of physicians, and all sorts of healthcare workforce.
Right.
And to empower more people to be able to provide comprehensive and integrated care, that's again something AI and technology could do very well.
So all the things you said were absolutely true, and they all had a little subtext to them called cost, you know? And so I just want to follow up on that because, you know, Ray, healthcare spending is going up everywhere, but here in China, it's been growing at a clip of 20% a year since 2003. That's kind of a staggering growth rate, and 35% of that is out of pocket. So how are we, you know, I know that you've been looking at companies to invest in reducing these costs, and there are a number of examples about trying to sort of bring the doctor in a different way to consumers that's much cheaper and outside of the hospital. Can you talk a little bit about how we deal with some of these costs?
Well, healthcare becomes a much burden, not only to the population, but also to the government as well. Used to be the healthcare expenditure covered mostly by out-of-pocket and the government social security fund. Commercial healthcare insurance is less than right now, this year is less than 7% of the over expenditure. In order to reduce the cost, I think the demand is there. How we can increase the efficiencies is the critical key. Leveraging on mobility, leveraging on artificial intelligence, and leveraging on the infrastructures. One of the companies, as an example, is that a company we invest as a 免疫综合. We know in China, it used to be, there's a system called the barefoot doctors. There's more than 1.3 million of doctors who are very trained, but they are licensed as a doctor and they do not have any technology support. So what the company do is providing them with a cloud-based platform which enable them in 3 ways. One is the clinical disease diagnostics supporting system, help the doctor to better train them with the knowledge and the practice to see the patients. The second is that we provide them with the electronic medical record. And the third is that we provide the supply chain of pharmaceutical products to them in order they increase the efficiency, have better diagnostics of the patients, and we provide them with a very cheap drug as compared to before they are in the very bottom of the value chain. So in the sense, we increase efficiency and decrease the cost in the same time by leveraging on technology.
So, you know, when I hear a lot about all the disrupted technologies in healthcare, so much of it, the really important stuff is the unsexy stuff, right? It's just making the trains go faster, it's helping with logistics, it's connecting the dots. There's so much of that. And in fact, just out off stage, we had a quick conversation with Simone who mentioned that even in genomics, in the sequencing, about 40% of that is AI or some sort of type of deep learning. You know, how do we do this? How do we make the electronic health records that were supposed to be so effective, Frank? And I know you've spent a lot of time on. How do we fix those?
Well, I think some of it is just growing it, trusting. You know, doctors are a very conservative bunch. I mean, you don't want to go to a doctor who's kind of like yippee-ki-yay. You know, you want a very, very careful doctor, and that's what we want. But at the same time, the challenge is we want to go forward and advance. But simple stuff, just sharing the record so the doctor doesn't ask you the same questions over and over again. It's not AI. It's just quite simply being connected. You know, if you land in A&E and you're unconscious, the doctor might have minutes to save your life. And really, really simple, boring stuff.
But in terms of getting the information that we need so doctors don't have to spend their time on a tablet or a system, I mean, we've got, you know, I've got my now Fitbit, or I should call it my Google Bit, I guess. But, you know, we've all got our devices, our wearables. Are we going to start to see in this transformation wearables turn to embeddables? I don't know how that's going to translate, but
I think where we're heading, when I grew up, like many of us, the doctor I went to was like half a mile from my house.
Yeah.
But now we're connected all over the world, and now we can do so much, as you say, with the watch. There are so many tests you can do at home. The hospital is a bit of an old construct,
Yeah.
and I think as we're going forward, I might want my diabetes managed by a doctor in Beijing using traditional Chinese medicine, but my depression managed by somebody in LA who's very good at dealing with that kind of thing. And I think we'll see it become much more global.
And Nini, I think China is in many ways taking the lead in the ability to sort of go outside of the box in some of these cases.
Absolutely.
Talk a little bit about what you're seeing here.
Yeah, I think what I observe over the years is people in tech start saying we are going to replace you, like replace doctors, replace nurses, replace hospitals. And they are in love with their products or technology rather than actually talking on a day-to-day basis to people who are already in healthcare, understand where the needs are. For example, in terms of like fall prevention, we know fall is a big risk for people of certain age to get injured and even mortality. Used to be that people all think we need to ask them to wear something to detect their risk of falling. But what about thinking out of the box, not just with your product, but think how much more naturally it could be to just have like a censored flooring at home or in public places to track people's gait, like how they walk. Are they having imbalances or are they having abnormal patterns? And then be able to predict without having them wear things that feel unnatural to them.
Yeah.
Just one small example. And the other things can be done if we use the same mentality. Can we think of not disrupting their existing way of living or working in healthcare, but trying to find subtle ways to disrupt or the inefficiency and cost ineffectiveness.
So Ray, is there a business model in putting these sensors everywhere? Do you see this as an opportunity, like you're as an investor saying, oh yeah, I'm going to definitely invest in the company that's investing in the sensor, gate sensor,
Well, I think there's a two-pronged approach. There's totally different segments. One is what we call the consumer wearables, which we can Fitbit kind of stuff that fit into that category. But as a serious healthcare investor, we are still looking for something that what we call the vital signal, that the signals that can help the doctors, and the doctors that have the set of proven standard, the doctors can recognize that they can use it as a real diagnostics. And I think one of the breakthroughs is one of the monitoring for the glucose. That is becoming reality. And so long as we have the breakthrough in those kind of wearables and embedded diagnostic tools, again, I want to emphasize some vital signal, the signals that can help the doctors.
And we know how important that is, like the ability to detect atrial fibrillation, which is a dangerous heart rhythm, using your Fitbit or your Apple Watch. But the challenge is that, Fitbit, their stock was in the tank for a long time to the point where Google could just scoop it up. My colleague Adam Lashinsky, who's somewhere in this room, wrote years about a company called Jawbone that actually made one of the first of these smartwatches, and that didn't go very far. And we've seen a lot of these companies, other than Apple, the big one, but they're not actually making a living doing this. It doesn't seem like it's that good a business model to investors yet. Frank?
Oh, I thought that was fair.
Well, Ray, you can take it because I am curious about.
I can take it because if you really look into some of the companies, mostly Fitbit comes with the consumer company, but the real innovation happens is behind. Maybe sometimes the companies that get into this space could be the companies like Huawei or companies like Apple. They have a huge consumer basis to start with. They don't have to do anything. The marginal acquisition of consumers is literally zero for them. And they can have a lot of cash on their, I'm back to really get into real technology innovations. And I'm hoping something happening within those big consumer giants, electronic giants that have the healthcare break through into the vital signal monitoring.
And it's not the device so much as the data that they get from it, right? Data is cash in this world, right? Data is that currency that everybody in healthcare wants, and they can learn from that. Nini, talk a little bit about the challenges of that. Who owns the data in this new world? Is it the consumer? How are we storing these unbelievable reams and reams of data that are coming with, if a single image from an MRI or X-ray is just, an unbelievable amount of data. So how are we going to deal with that?
I think it has to start with what the data is used for.
Yeah.
Most people think home health, which is the sector I'm in, is very much labor or talent intensive. So you need a lot of people to do the work. But actually, it's data intensive. For every person, every once in a while, we get a lot of assessment data, and then we use that to feed into an algorithm to tell the first-line caregivers what type of integrated care services are needed. And for every time they actually provide the care, they collect additional data that will give them feedback to how well the algorithm did and how better it can become. And this data, I think, if we use it carefully to inform all the providers, including hospitals, including other institutions, and the individuals in the system, it can really increase the level of integration and the outcomes that are related to people's quality of life. But then if we use it just for the sake of developing some data products that the market or the end users don't see the benefit, then they are concerned, well, who's profiting from my very private personal data, especially in healthcare. That could be, if abused, it could mean a lot of risk for individuals and the society.
Yeah, that conversation has been happening for years now in the United States. I want to see if there's a question in the audience, because we've got this extraordinary panel here. Can we get the lights up? Anybody have a question? We have a question right there in the back. Could you just identify yourself, please?
谢谢主持人。
Thank you. Thank you. From Guangdong Pharmaceutical Holdings. I myself is a kind of food supplement, and you talk about public health issue, and I have some questions for you, because the general public is very much concerned about medical treatment after the outbreak of the disease. For example, if I cannot work, then how you can help the patient get up again and leave them by themselves. So it has become a global challenge. Medical spending keeps growing, and many governments have come under severe pressure. Then my question is, why should we shift our focus before the outbreak of disease?
For the TCM, traditional Chinese medicine, we focus on the prevention. We listened carefully a lot of cutting-edge technologies. We believe it's very fearful. Why couldn't we identify the sources of the disease from the prevention, and people would pay more attention to the health and well-being and wellness to change their exercise method and mental health, physical health? I think this is more important than spending huge amount of money to cure and treat the diseases, because we were talking about a longevity issue. But now what we were advocating is both longevity and in good health, because we cannot stop the steps of aging, but we want to be aged in a healthy way after getting very old at 90 years.
It's a great question. It's an important one.
Sorry, maybe I'm a little bit off track.
Answer to that question, yeah, please.
That question.
Yeah, please.
因为我在这个
Because I work in the governmental agencies, I made a lot of investments in science and R&D and health. Three questions, three answers. The first is policy change, including R&D change. and a lot of budget being reduced for the cure and treatment of diseases. Instead, we invest a lot of budget to the grassroots and primary levels and to do the prevention work. Second, from the commercial business point of view, in U.S., why they had so many preventions, because one of the biggest players in U.S. is the insurance companies. They know in the health economics, they should go to prevention instead of cure and treatment. So insurance companies intervened and market-based approaches. They use economics to resolve the problems. The third aspect, we use technologies, as you said, nutrition and the supplements for the microbiograms. R&D making strong breakthroughs. If we can have tailor-made or individualized these microorganisms to have a tailor-made supplements and nutrition. So maybe it's a very good prevention for the stomach diseases, for example. So both the market-based and the technology advancement can solve the problems. What I want to add is only one point, because there are a lot of interconnections between the two. The prevention in the public health arena, why not enough attention being paid to the prevention? As Wei rightly pointed out, it was due to the budget allocation disbursement mechanisms, because our reimbursement system is based on the consumption of drugs and also the cure and treatment. If that's still the case, we will not allocate more budget to the prevention. But in U.S., they use the modalities to provide the coordinated interest of the insurance company and the disbursement of the money, and they focus more on outcomes. Then there would be more efficient and effective investments, and more investment would be shifted to the prevention aspects. The gap between the two is the data. Especially in the TCM field, we do not have a strong data support, evidence-based, to provide larger services to the huge populations. Now we are using information, data, and AI to link these dots. And we've seen dramatic changes already. And in the future, we are going to invest more energies, efforts into the prevention and prediction work.
The question, and for those good answers, because I think that was an important turn in the story. I want to get to you, Frank. We've got 1 minute left, or a little bit less, but Tencent is investing here in New York, here in China rather, on WeDoctor, a telemedicine effort. Ping An is doing. They have an investment called Good Doctor, and so this idea of telemedicine that's been coming around is a way to sort of get around that challenge that you mentioned right at the outset, which is the doctor is right in the middle, and you've got to connect. When is that going to start to become a reality for people?
Well, I was actually with WeDoctor in Hangzhou the other week at the International TCM conference, and I think you're going to start to see it happening now.
Yeah.
And I think with the AI, and I thought Nini's point was very good. Whenever I say AI, people think, oh, you're going to replace doctors. Yeah. Well, I use a spelling checker when I'm writing a Word document. The spelling checker doesn't replace me.
You're also married to a doctor, so that could be a challenge too.
Yes,
right?
yeah. Well, that's a whole other story.
Right.
But it's something to help the doctors and move the doctors along. And I think, I think the lady's question there was very interesting. We're looking now at getting AI to manage diabetes, and we think we can manage it in the way that a doctor will, to stop you becoming diabetic, which is prevention. And I think you're going to start to see it over the next 2 years.
Okay, we're going to have to leave it there. Thank my guests very much. That was a terrific conversation. Appreciate it.